Hi, I'm Brian Gaston with Ohio Labor's Benefits Office. You as a new apprentice, you're probably getting ready to have your insurance eligibility kick in. So one of the first things you need to do as a new apprentice with the benefits office is you need to fill out a new enrollment card. Enrollment cards are how we know your personal information. We know where you're located, so your address, we have all your contact information, phones, emails, things of that nature, so we can send you the information that you need to take advantage of the benefits that you offer. You can get enrollment cards from your apprenticeship coordinator, the benefits office, or by contacting your local. You can also get these enrollment cards through our website, ohiolabors.com. One additional thing with the enrollment cards is this is how you enroll your dependents to our insurance plan. So you can add your spouse if you're married, or any children that you may have, whether it's a biological child, a stepchild, or an adopted child. We can cover your children and your spouse at no additional cost to you. In addition to completing the enrollment card, when you enroll dependents, we will also need proof of that relationship. So if you're enrolling a child, you'll need to send in that child's birth certificate. If you're enrolling a spouse, you'll need to send in your marriage certificate to that spouse. So we talked about your initial eligibility after working 450 hours. After that, maintaining your insurance is a little bit more complicated. In general, the more hours you work, the longer your insurance benefits will last. And one nice thing about the initial eligibility and continuing eligibility, as long as you work enough hours, you will never have to pay a monthly premium to maintain your insurance benefits. So the more hours you work, the longer your insurance eligibility will last. Now, we have 3 different calculations for maintaining your insurance eligibility, and they're kind of confusing. So I would recommend tracking it online or calling our benefits office if you have any questions about how long your insurance eligibility will last. So as a new apprentice, your insurance eligibility will kick in after you work 450 hours. And one thing to keep in mind with your hours and the benefits from our office is that all the hours have to come into our office and be paid for by the contractor before those benefits will take place. So generally, there's about a 1-month lag in those hours getting reported to our office. And if you work in pipeline, those hours may be delayed a little further because they go through a separate fund before they come to our office. So generally, you're going to be eligible for a week or 2 before you actually become eligible. But generally, the first of the month after you work 450 hours, your eligibility will kick in. But you may have to wait a few weeks before you know that. Now, if you do have any claims during that time period where you are eligible but you haven't been notified, you can always have those claims resubmitted through your primary care physician or the hospital or doctor's office that you may have visited. One of the great benefits as an Ohio laborer is Live Health Online. Live Health Online is a really cool app that you can download onto your phone or tablet, and you can talk to a doctor at no cost anytime during the day or night. They're available 24/7, 365 days a year. So it's a nice opportunity for you to talk to a doctor without having to go to the doctor's office. And the one nice thing about it is that it costs $0. There is no copay associated with going to using Live Health Online. Another nice feature with Live Health Online is that they do have mental health care providers as well. So with your mental health care providers with Live Health Online, you do need an appointment. So you can visit with a psychologist or a psychiatrist at no additional cost, but you do need to have that appointment. However, sometimes you do need to see your primary care physician, or sometimes you need to go to the ER or to urgent care. If you do any of those, there are co-payments associated with each of them. To visit your primary care physician, there's a $20 copay. For an urgent care, it's a $50 copay. If you see a specialist, that's only a $30 copay. However, if you do go to the emergency room, there is a $150 copay. So the insurance fund does offer a lot of free wellness supplies and services that will help members stay healthier. A few things that we offer for no cost for our members and their enrolled dependents are free smoking cessation drugs. So if you want to quit smoking, you or your dependent, you can do that at no cost. You just need a prescription from your doctor, and then we can start you on whatever type of medication to help you quit smoking. For any females or enrolled dependents that are females, and we do offer free birth control for women. So if that's an option for you or your dependent, those are free as well. You just need a prescription from your doctor. We do also offer certain diabetic supplies. So if you or any of your dependents have diabetes, a lot of the testing supplies. Additionally, we cover flu shots at no cost, well visits for children, routine annual physicals and all the lab work associated with those, and certain other preventative services. So we gave you a brief introduction today about our insurance benefits. If you have any questions about the topics I covered today or any other insurance questions in general, feel free to contact us. Our number is 1-800-236-6437, and we have a staff of insurance specialists that are here to help you. Or you can check out our website, ohiolaborers.com, which has a wealth of information about all the benefits that we offer.